And it's really interesting. I think, we're in a place now where education is more important than ever. And actually, the education needs to be actionable. We need to be able to make sure that our learning affects the system and the system basically encourages you to learn. So my day job is CEO of the Digital Academy, and that's getting the very top people, the CIOs, the clinicians that work in a senior level, ready to work with boards and in policy and really at the very top end of the chain. But I've become incredibly interested in the entire end-to-end. And that entire end-to-end is interesting because we have this high-end program now, but the people that have actually ended up on that program have not had a career path, a formal career path to take them there. They are, either brave or curious, or have, in some cases, ended up there by accident, not in a bad way by accident, but what I mean is their career path hasn't been planned and it's just taken them there and it happens to suit them. For me, the future is going to be about understanding what credentials we need, and it's going to be about dynamic career paths. If you've not had a chance to ever look at the Topol review, it's worth going and looking at that. That's about all of the new careers in health and care that are going to be out there. And they're very interesting because, doctors, nurses, senior people in the NHS, people in care are going to need to know a bit about technologies. They're going to need to know a bit about data, a bit about how tech unconstrains care, and the art of the possible so that we can redesign care. And so we're going to see, I think, in traditional sort of medical schools, nursing schools and so on, there's going to be a lot more of technology, data, digital leadership in that education. But more than ever, actually, we've got to keep learning for life, right? You learn about technology, you learn about data, but that changes over time. The art of the possible changes over time, and the possibilities change over time. And there's a lovely bit of the NHS Constitution, and it says that we will work at the frontiers of science. That's in England for the Constitution for the NHS. And what has fascinated me recently is the kind of micro-credentialing that people will need to keep in step with the art of the possible to deliver care at the frontiers of science. So the frontiers of science are the balance of things being ready and an opportunity to improve health and care at the right time and embracing them at the right time. I think the emerging career pathways are going to be very exciting, but equally what I would say is that we need to make sure that people can navigate those careers in a flexible way. And what I mean by that is, we're going to see doctors that specialize in algorithms. We're going to see, therapists and nurses that work with data. We're going to see all of these different sorts of hybrids of sort of clinical, technical, operational. And I think that, the ability for us to create an entire learning health system with a body of content, which will allow people to have the same shared frame of reference and language, is really important. So overall, HE, Health Education England, they are going to be commissioning and delivering the sort of the high-level framework for that education across the UK. But what's really, really important is that we commission education at every level in a congruent way for that. So I'm interested in everything from apprenticeships at sort of 16 or 18, and they can take you to master's degree. You can do a master's degree apprenticeship right the way through to how we create our leaders and create pathways that people can almost get curious about what their next career move may be, and perhaps get some of those micro credentials to actually look at whether they're more interested in pursuing this pathway or that. I think one thing that's very interesting for me with the privilege of working with so many doctors is when they were trained, many of them, they were told there was a linear sort of progression. They were going to go and they were going to become a consultant. And as soon as you break that open for them in this new world and say, well, actually, you could become a digital doctor, or you could become, a medical director, but also become the CCIO, so the Chief Clinical Information Officer for your organization. It's really quite a strange world for them because suddenly everything's changed. Their possibilities have opened up rather than it being a very certain career pathway. And for some people, that's great. because they like that broadened horizon. For other people, I think, they kind of say, well, tell me exactly how I get there to these new digital careers. And as these pathways are emerging, it's quite interesting because it's really the pioneers, the people are blazing those pathways that are formulating the careers with the likes of the Faculty of Clinical Informatics. And so there's not that hard-coded pathway, and we don't want to hard-code it too far, but what we want is education to become, what I would say, the lubricant between all of the wheels in the system to allow you to navigate to where you can add most, value to the system and where your skills are. The other thing I would say is that as we move into AI, and I sit on the AI Council for the government, so AI is a while off, true AI, but automation, intelligence, machine learning, and AI. All of our clinicians are going to be working nearer the top of their license. So, if I go and talk to one of my dear friends, Dr. Rizwan Malik, who's a divisional director for radiology, he will say much of the reporting he does on radiology images is just very standard. But he really enjoys doing the sort of cases that are quite unusual and working with colleagues on those sorts of cases. As we find, that we can use this automation and AI, it will allow us to perhaps move from two people reading an image to just one and a human, or perhaps eventually, if something is very standard and clear, it will have, two computers both reading the image, and then the exceptional ones will have a human and a computer. But that in turn means that our really rare skills that we have, many of the clinical skills we've got, can be put to best use, because we do have a lack, say, of radiologists in the system. And an increase in modalities, so more things to read. Certainly the region that I came from, that was increasing by about 10% a year, because we have more kit and we can image more and we know more about imaging. And so, you're going to have all of our clinical workforce moving into this more interesting space because we can do more. And then we're going to have that automation, AI, intelligence, doing more of the work that they shouldn't have to do. So the really basic stuff, the perhaps keying of stuff into systems or across systems, the joining of data, the sort of admin work that they shouldn't do, and the intelligence pieces, which, really can be done by sort of, machines. Another really interesting aspect of that as well, and I'll come back to Dr. Rizwan Malik, is that not only does he want to report the most interesting work, but he wants to be the master of the algorithms. He wants to be the clinical safety officer. And he sees that very much, and we've had really great debates about this, as supervising a junior, if you like. He sees the algorithm as a very junior member of staff that he needs to supervise, audit, and so on. And so if you think, that's just one specialty, radiology, but if you take that out over all of our clinical staff, our nursing, our therapies, our pharmacists, and our administration staff, you basically have a need for all of those staff to have an awareness of what digital can do for us, an ability to engage with it with curiosity and not fear, an ability to leverage it, and for those that really want to get into it, an ability to lead and manage in that space. And that's going to take a lot of education. So I've been involved in something called the Arch Collaborative, which is a body of knowledge around the importance of certain factors in digitization. It actually turns out that regardless of the system, 60% of the success is down to the education and mastery of the clinicians and staff engaging with it. And so brilliant education, and we prove this with that body of knowledge with over 200,000 clinicians in it. Mastery, safe practice, and improvements in quality of care all come down to education and mastery. And that's not being talked at in a traditional way. It's about vibrant, digestible education that will allow clinicians to actually feel they've mastered the technology, the systems, or whatever they're working with. So I think education is increasingly important. I think education for life is increasingly important. And I think, I'm looking forward to working on this lifelong infrastructure for learning to ensure that our workforce have the ongoing capacity and capability to allow us to work at the frontiers of science, as we've got in the NHS Constitution, and make sure that we can really balance that opportunity and risk of innovating. But actually, as I remind people, an opportunity missed is a risk if it can improve lives and save lives. And so we have to get really good as a system at getting people into that confident mastery state and actually balance the sort of risk and opportunity as we walk that tightrope towards, the frontiers of science that will really enable us to improve lives and save lives. So that's everything from me, but thank you very much. And I really do hope all of you consider engaging with careers in digital health, because for me, it is one of the richest and most wonderful domains to work in, and a real privilege when you do get involved in people's career journeys, and indeed operationally, as I have done before, with improving lives and saving lives. Thank you.